Merseyside's coronavirus infection rate is now almost in line with the national average as cases have continued to fall across the region. The latest figures from the government show cases of COVID-19 in the city region have halved since they peaked in early October, as successive restrictions have reduced transmission. In the week up to November the 6th, there were 267 new cases per 100,000 residents, compared to 540 new cases per 100,000 at the peak of the second wave on October the 9th. With England's national infection rate reaching 247 per 100,000 residents in the same week, the city's no longer among the country's most infected areas. Since the beginning of October, both Liverpool and Knowsley have seen their infection rates fall by well over 50%, while Wirral's has fallen below the national average. The rapid fall in Knowsley has left St Helens as the borough with the highest infection rate in the region. Since November the 6th, infection rates in several boroughs have begun to creep up again. However, that's likely due to the introduction of mass testing in Liverpool rather than a genuine increase in infections. The mass testing drive, which started at midday on November the 6th, has already identified 220 cases of COVID-19 in people who had no symptoms and would otherwise have been unaware they had the virus. The figures suggest not all of those cases have been found in Liverpool itself, with people who live in other boroughs but work in the city also able to get tests. This would explain why infection rates have begun to rise in places like Knowsley and Sefton as well. Despite the decrease in cases across the region, infection rates still remain high. Even in Wirral, the Merseyside borough with the lowest infection rate, cases are still more than 20 times higher than they were when the first lockdown ended on July the 4th.